So I've had retired NFL players come through here and say after their career, throughout all the traumatic brain injuries they've gotten, concussions, their cognition isn't the same. Their strength, their balance, their personalities have changed. So we have them come through. One example, I had one retired player. He came to our clinic a few years ago for a tour, and he pulled me aside and he said, "This is the first time I left my house in a couple of years." That's how affected he got after his playing career. He came in with sunglasses, barely talked to anybody, got through the program. We did the assessment. We saw the degree of changes in his brain and damage in his brain, and the decline physically as well. When we went through the program, you can kind of see a subtle change with time. Came in with the sunglasses, didn't talk to many people, then little by little would open up to some people here and there. By the end of the program, no sunglasses, talking to everybody, social butterfly. Even after the treatment, he comes by all the time to say hello and talk to people. He said we completely transformed his life. He felt in better shape now than he did during his playing career. He's a lot more focused. He's more active in his business endeavors. It was a completely transformative feeling for him.
And not only that, Mo, I just had dinner with him and his wife last night. and his wife, Jen, would tell you, it's like her husband's growing up right in front of her eyes. She spent 10, 15 years with him and on this whole decline, depression, anxiety, and to watch him grow and flourish along with their 11-year-old son. She said it last night and almost brought tears to her eyes. How often do you get to watch your son and your husband grow up right in front of you?
It can be very dramatic. And one of the biggest things that drew me to the company was their stroke research. And I had one of my very few first clients was a gentleman that had a stroke 8 years before he came to the clinic. And he was in a wheelchair. And, we told him during the assessment and even in the initial consultation, I can't bring dead tissue back to life. So those cells that are dead from the stroke, they're always going to be dead. But often with a stroke or any injury, you can have injured tissue that's not functioning properly as a result of that stroke or injury that we can bring back. And we can grow and replace some of those cells as well. So he knew the limitations, but he said, great, let's do what we can. By the end of the program, he was walking out with a cane and no longer needed the wheelchair to move everywhere. One of his things on his wish list was, I don't want to be a burden on my wife. And forgive me for being a little crass, I'm going to quote him, I want to wipe my own ass. He needed help with everything, something as simple as that we take for granted. He wanted to be able to do. And he was walking out with a cane. Wife was very appreciative and saw the changes, not just physically from the stroke, but when it comes to stroke or trauma, your personality changes. This is a phenomenon well documented with strokes and injury to the brain. You will have depression. You will have changes in your personality. And that's something that he didn't want to admit at the beginning. But by the end of it, he said, you know what? I was different and I'm back now. So he also comes and visits the clinic all the time and they're doing well.
That's one of the beauties of a true healing treatment, not just managing symptoms, not just managing disease, is that when you go through healing, there's a true change in mind, body, spirit. And it's almost that spirit that's the most vivid, that's the most changing in a person, that gets them back to their authentic self. And one of the things I did notice there when I was there, you did combine this. Listen, you got to be committed to it. You're a part of this healing process. You got to be assessed, on a daily basis, basically. So it's not just one snapshot and then when we're done, another snapshot. It's almost snapshots all along the way. So you know the progress that you're having. And in a way that sort of confirms it and gets you to be more involved and committed. And finally, I love that you did have that purpose area. Dave, we talked about it when we were in that chamber. That purpose-driven medicine is so important these days. You got to have a purpose to get better. And for many people, it's quite obvious. I just want to walk again, right? And that's an amazing, amazing goal to have. But for others, it has to be something deeper. It has to be something that really resonates with their heart. And that was really cool to see with a lot of the patients that are there. They did have these parts. They were committed. Now, you've seen the signs. You've seen the results. What is the resistance or what is the setbacks to having the whole medical field be on board with this? because it is still somewhat, you could say, fringe. It's still not readily accepted, I guess. When you go to a stroke specialist, I'm sure their first thing they wouldn't say is go to Aviv clinics. They would try other things as well. And that, Dr. Mo, because you've been in that realm before coming to Aviv. So what do you think it's going to take for this to start to readily be accepted?
Yeah, it's a great point, Casper. If before my father's stroke, if you told me, oh, there's this clinic that's using hyperbarics to heal the brain after a stroke, I said, okay, I've never heard of that.
Yeah.
So I think the biggest thing is education. This protocol has been around for the past 15 years. It originated in Israel, and now it's here in the US and other places. So it's going to take time. We need to educate the medical community on what is possible with this protocol. We've been prolific with our publications and our research and reproducing it over and over. We actually literally just published another paper on long COVID. That's always in the news. And just today, we published another study on how this protocol can help heal the body and the brain from the consequences of long COVID. So it's going to take a lot of research, publications, different diagnoses, different things to get to your point. Purposeful medicine. We know the pandemic of acute COVID is there, but the pandemic of long COVID is going to be much bigger. And it's going to just be prevalent longer and longer. So maybe the way I sought out the treatment for my father will be the same way people seek out our treatment. And as we get the education out there,